In a year of the Me Too movement, natural disasters, and too many violent acts to count, we're bombarded with traumatic events and trauma-triggering headlines. And trauma can take many forms, ranging from emotional and psychological abuse in childhood to a sudden and life-changing event in adulthood. Here to talk about all of that and the importance of recognizing trauma is Dr. Maggie Tipton. She's the Clinical Supervisor of Trauma Services for Caron Treatment Centers. Dr. Tipton, thank you so much for being here.
Thank you for having me.
So let's start with this. What is trauma and how does it impact a person if it's left unresolved?
So trauma, typically people think of single incident trauma, a single rape or event in combat that has led to trauma-related symptoms. The area where people sometimes don't always know as much about is the people who have had ongoing traumatic events in their life, and that can start as early as childhood. It can be continuous throughout childhood. It can start as late as adulthood, but it can be multiple traumatic events in adulthood and moving even into later adulthood if untreated. We call that complex post-traumatic stress disorder. And if it's untreated, it will affect every area of that person's life. And sometimes they don't even realize it's going to affect their life because they become so good at detaching and really getting into certain behaviors, including substance use, to cope and survive.
And what is trauma-informed treatment and what techniques do you use?
Trauma-informed treatment is anybody in the treatment center or anybody working with somebody who, or a patient, a client, an individual in general, is aware that they have a history and that could include trauma, and so they're going to be sensitive to that and help them to cope in situations that might cause more stress. So really everyone in a place like Caron Treatment Centers, everyone is trained. And in some way, some people are trained a little bit more than others, but they're trained in how to approach and respond to somebody who could potentially have a trauma history. And so as far as Caron's treatment, we tend to use phased approach treatment. So phase 1 treatment is generally safety stabilization. So we're helping people self-diagnose, but we're also helping them to learn various means of coping so that they can regulate their emotions so that when stress arises, they don't tend to revert back to some of their early trauma-related symptoms like fight or flight or freeze. The other thing that we do is cognitive processing therapy, and one of the things that we like about that is that it actually helps to challenge avoidance while also helping them to change some of the beliefs that they came to out of the way that they made meaning of the traumatic event that wasn't exactly accurate and led to feelings like shame, blame, mistrust, when in reality they then didn't get to feel things like sad, hurt, and fear.
Sure. Well, I think that's a good place to leave it. Dr. Tipton, thank you so much for being here. We really appreciate your time. And if you or a loved one need help coping with trauma, you can visit caron.org.